Hello, good morning everyone. So today we are starting about the cataract. In the previous lecture we was study about the cataract. Cataract its different types in detail. So cataract is the opacity of the lens. Lens is a avascular, therefore it cannot develop inflammatory diseases, and commonest disease is degenerative process. So it leads to the opacity of lens fiber and it leads to the cataract. So in the classification, we we was study in the previous lecture that the various types of the cataract, like the congenital and developmental cataract, blue dot cataract, coronary cataract, capsular or polar cataract, sutural cataract, corolliform cataract, floriform cataract, central cataract, lamellar cataract, total cataract, that is a soft and membranous cataract. So in the next we was learn about the diagrammatic presentation of the cataract. That is, this is a coronary and peripheral cortical cataract. This is an anterior cortical cataract. This is a subcapsular cataract. This one is a pyramidal cataract. This is a nuclear cataract. This is a lamellar cataract. This is a posterior cataract. That is posterior polar cataract. In this, we will study that acquired and traumatic cataract. In the acquired cataract, there is a senile or cortical or cuneiform cataract, nuclear and postcortical cataract, and in traumatic cataract, there is a due to the mechanical trauma, that is a concussion, contusion, or penetrating injury. It is due to the chemical radiation or the electric passage of electric current through the body. Then, due to the endocrine diseases, cataract occur. Due to the systematic diseases like Mongolian idiocy, myotonic dystrophy, and dermatitis, cataract can be occur. And complication, we was also learned in previous lecture. So, we will learn about the blue dot cataract, coronary cataract. That this is a diagram of a coronary cataract. That is A and B. This is the oblique illumination and in optical section with the beam of the slit lamp respectively C. It is the clinical photograph. Then next is the anterior capsular cataract, posterior capsular cataract, sutural cataract, corolliform cataract, central cataract, lamellar or zonular cataract. This is a diagram of a lamellar cataract and that A and B. In that diagrammatic depiction as seen by the oblique illumination and in optical section with the beam of the slit lamp respectively. And this is a clinical photograph of a lamellar cataract. This is a total cataract. This one is a unilateral or bilateral, usually congenital. Entire lens is opaque and lens may remain soft and liquid. बाहेरून कडे treatment it depend on the visual disturbances, that is jugular and total cataract require a treatment and other type do not cause much visual disturbances and may be left alone. So this is the diagram of a cortical cataract. In this we can see this is the lens, this is the oblique cortical spoke, this one is the iris, that we can see that how the lens are swollen in this. This is the nucleus, cortex and capsule. So this is a diagram of a posterior subcapsular cataract. In that we can see how the granular deposits in this cataract. This is the iris, this is lens, and this is the deposition of granules. This one is the nucleus, cortex, and capsule. So this is the posterior subcapsular cataract in this granular deposition is occurred. Then the lamellar cataract, that is the most common type of the congenital cataract, occurs from a opacification of a specific layer of zones of a lens fiber. Then this is a lamellar cataract. This is a nuclear cataract that's situated in the center. This one is a subcapsular cataract. This is coronary. This is the polar, and this is the posterior cortical cataract. So we will learn about the senile cataract, the types of the senile cataract, that is cortical or cuneiform or soft cataract. Then the symptoms of the cataract, that is the granular impairment of the vision, polyopia, and signs. So, in the acquired cataract, there is a symptom of cortical cataract, that is a gradual impairment of the vision, polypia, rainbow halos around the light due to the accumulation of water droplets in between the lens fiber, and size that depend on the stage of the cortical cataract. In this, there is the incipient stage, that is the scope of the opacity with the clear area in between the periphery of the lens. And progressive stage, there is the immature stage. Second is the progressive stage, further opacity is occurring in. Then third is the immature stage, that is the opacification increases further, lens appear grayish, cortex is still clear, no iris shadow is still visible. Then iris shadow, it is a shadow of pupillary margin on the lens. When the oblique light on pupillary margin, and importance that there is a still small amount of a clear lens matter present below a capsule. So this is the diagram of the immature stage. Then this is the then fourth is the intumescent stage of the acquired cataract, and fifth is the mature stage. So this is the diagram of a mature stage of the cataract. That's how it matures. Then sixth is the hypermature stage. In that there is a Morgagnian type and sclerotic type. So this is the diagram of a Morgagnian type of the cataract. In that it was learned that all the cortical matter liquefies, lens is converted into the bag of milky fluid with a nucleus settled at the bottom. That this is nucleus which was settled at the bottom, iris shadow disappear, and cataract appear uniformly, that is milky white. Then a diagnosis. In that immature cataract is seen like a grayish lens, iris shadow present, finger counting at a close distance to the eye, and there is a black shadow against the red fundal glow on the light in the dark. And in mature cataract, there is a pearly white lens, no iris shadow, vision reduced to the perception of hand movement, and there is a no red fundal glow on light in a dark room. Next one is a nuclear or hard cataract. In that there is a lentil sclerosis, lentil fiber undergoes sclerosis. When this process is intensified, there is a nuclear cataract start. and nucleus become diffusely cloudy and obstructed light rays. So lanes appear brown or black due to the melanin deposition, that is the black effect. It never become a hypermature. Progress is slow. There is myopic eyes are more prone to develop in these cases. Then the symptoms of nuclear cataract, that progressive dimness of the vision but no polyopia. Defect of vision is due to the myopic error and cloudiness of the nucleus, and treatment is that there is a concave spherical lens in the early. Signs are lens is a brown or black, iris shadow present, reduced vision to counting fingers or perception of hand movement at a distance close to the eye. There is the dark room examination, that is the central dark area against the red frontal view. So this one is a nuclear case. This is a nuclear case. Then a posterior cortical or cupuliform cataract. In this, optical opacity develop in the posterior cortex immediately below the posterior capsule, and it starts in the central area and spreads slowly in the rest of the posterior cortex, but never beyond this area. Cataract is made up of minute opacities with the cholesterol crystals. Progress is very slow. Cataract remains as it is for years and is never matures. The symptoms are posterior cortical or pupiform cataract. Is that symptoms are marked fall in a vision even when with a small opacity, because opacity is near the nodal point of optical system of the eye. No polypia or halo around the light. Vision is defective more in daylight, and there is a day blindness. Constricted pupil in the daytime and dilated pupil at the night allow a more light rays to enter the eye. Signs are there is a dark room examination, that is the central dark spot against the red fundal globe. Examination by slit lamp, that is location of opacity in the posterior cortex. Then traumatic is that there is a mechanical trauma when traumatic cataract is occur when there is a mechanical trauma. That is when there is a penetrative injury to the lens capsule. When there is a lens capsule is perforated, there is a penetrative injury to the lens capsule, so it leads to the mechanical trauma. In the concussion, capsule is damaged and its semi-permeability is altered. So, when capsule is damaged and its semi-permeability is altered, then concussion is occurred and it leads to the mechanical trauma. So there is a rupture of the capsule. So in the types, when we see that there is a punctate opacity in the superficial cortex, there is a rosette shape, that is the petal of a flower shape seen in this mechanical trauma. They develop in a posterior cortex. So this punctate opacity is seen in the posterior cortex. Posterior capsule is thin and easily damaged. So it forms a opacity and may remain stationary or progress till entire lens is open. Total cataract. There is a severely damaged capsule. Lens fiber come in contact with the aqueous humor, swell and become opaque. Voisier sign that in that rings of the brown granules of the pigment with the faint opacity may be formed on anterior lens capsule just behind the pupillary margin. So in the total cataract, there is a severely damaged capsule. Lens fiber come in contact with aqueous humor, swell and become opaque. And Voisier's sign is that there is a ring of a brown granule of pigment with the faint opacity may be formed on anterior lens capsule just behind the pupillary margin. So next is the chemical trauma. Due to the chemical trauma, traumatic cataract is also seen, that it is mainly seen in animals due to the naphthalene, lactose, galactose, thallium. In the radiation trauma, there is the infrared cataract, UV cataract, irradiation cataract, and electric cataract. In the infrared cataract, due to the prolonged exposure, glass workers, furnace heating workers, and UV cataract, that is the due to the prolonged exposure to the minute UV rays in the sunlight. And irradiation cataract is due to the X-ray and radiation. That is the direct action on dividing cell and on developing fiber of the lens and long time to develop. Electric cataract in that there is a passage of a powerful electric current through the body, so it leads to the cataract. That is the traumatic cataract. So next one is endocrine cataract. The endocrine cataract is seen when there is endocrine disease to the person, like a diabetes, is seen in the young diabetic patient when the fluid vacuoles below the anterior and posterior capsule and lens become opaque soon. So it is rarely seen, that is diabetic cataract, it is rarely seen. Parathyroid cataract, that is the removal of parathyroid during the operation on the thyroid and start as a discrete opacities in the cortex within the 6 month opaque and lens. So other types of the cataract in that we can see about the cataract due to the systemic diseases, that is the Mongolian idiocy, myotonic dystrophy and dermatogenous cataract, that is the severe dermatitis, neurodermatitis and scleroderma, and cataract due to the drugs like corticosteroid and myopic cataract. So when we see the cataract due to the systemic diseases, it is due to the Mongolian idiocy, myotonic dystrophy, dermatogenous cataract, that is the severe dermatitis, neurodermatitis, and scleroderma, and cataract due to the drugs like corticosteroid or myopic cataract. So next is when we study about the detailed classification of the cataract, the next topic is the homeopathic therapeutics of the cataract. So, in that, for the cataract, we can use the ammonium carb, calcarea phos, cannabis indica, causticum, cinenaria, colchinaria, colchicum, conium, euphrasia officinalis, iodum,